All right, I'll see you guys later.
Okay.
Bye.
Bye.
Bye. Okay, so this is the executive committee meeting. So the treasurer's report, we have a balance of $2,219.19. I saw go by a bill for our participation with California Institute of Behavioral Health, I think, the one that Teresa Comstock is running. And so, Tori, I think that gets paid from the county funds, not ours.
Oh, okay. I will correct that.
Yes, I think that's true. And then I don't see Bill yet. I know we're going to let him go when he gets here. So we have 3 vacancies, one in District 2, one in District 4, and one in District 5. And District 1, I believe it is. I haven't seen Patricia for a long time, Patricia Gray. And so I'm going to be contacting her, and I know that Supervisor Gorin had asked about participation there. So I'll be talking to her, and Susan will as well. So that may be a 4th vacancy. We will approve the minutes of the October 19th meeting at the meeting on the 16th. And hopefully everybody's gotten those draft minutes. And let's see. Okay, so posting site visits to the Mental Health Board website. That's where we left off in the last meeting. And the last thing, I mean, we talked about the thought that they were, that's part of our job is to, look at different programs. And the last thing that was said was Michael was saying that having been some place where, we might have been looking, that his strong feeling was that we should be as transparent as possible. And if there was, that kind of the concern was, what if there's a negative? And, that should be out there as well. So what, does anybody have further discussion, objection to going ahead and putting those on the website? Yes, Bob.
This isn't referring to putting on the website, but I told all the people we conducted the site visit that we'd send them a copy of the report after the executive committee saw it.
Right, so we send the copy of the report to the site?
Yes.
Yes, and to Bill?
Yes.
Okay, and then you were, you weren't here at the last meeting. We had kind of a discussion that went over into overtime and didn't finish it.
I was at the meeting, pretty sure.
Were you?
Yeah.
Okay. Well, good. My memory is bad. So we kind of left at the point where we were really leaning toward just put the reports out to the public.
There's really no significant negative findings. And I think if anything, if people read what we found, it'd be very, it's very positive. That wasn't the intent of the visit. It was to be objective. But as a result of it, I think we saw many positive things.
Okay.
But like Bob was on one of the site visits. I think Carol was too.
Right.
They might want to comment, but I think it was very constructive. Kind of not audit, not really audit, but review.
So the kind of where we left off, the consensus was it's been really positive so far, but if it didn't end up being positive, that would just be the way it was.
Yes, exactly.
So so is everybody, well, that's not, does anybody have an objection to those things being posted? The site visit reports being posted? Bob Cobb?
I don't object. I wonder what happens if we encounter some significant problems, what the protocol might be to the objective being to resolve them. Not necessarily, certainly transparency is important, but what if there is something discovered in future that is problematic? How is that addressed rather than just shooting it out to a public forum?
That's the big question. So
See, also another related issue to raise is in the report. What if I'm always concerned what we might not be accurate in some of the findings, because they tell us that we write it down. And if we send it to them, they could correct any errors that might be. I don't know what they are, but that's another concern. Make sure it's accurate. I think it was as much as possible. Well, there could be a small error, but the whole report, I think is fine.
so this all resulted from a request from a specific person to see the report from one of the visits.
Yes.
An alternative to just putting it out to the public is to say that the reports are available by request, which also kind of puts it out to the public. I just don't know, because my concern is the same as Bob's. What if we do come up with a real issue and we don't want to just put it out as, here's the dirty laundry. But we want to be honest that there's, that we found something that's an issue.
Yeah, Kathy?
Carol?
I would suggest, I would certainly like to see it to be public. I think we are a public-facing organization, and the one place in the county where people do get information. So I personally would like to see the information shared. But in terms of giving people adequate ability to respond, both for accuracy, but also I imagine that if we do find problems, that they would not be unexpected to the agency that we are reviewing, and that they would have already thought of some potential solutions. So if we have frame any negatives in conjunction with potential measures for correction. So definitely from the individuals that we have been speaking to, but perhaps any suggestions that we as a mental health board have as suggestions, maybe partnerships with support, or if it's a funding issue, what avenues people can use. So really trying to, because I think the biggest fear from the folks that, if we're going to be doing site visits and we are going to be making them public, they're just going to clamp down and they're not going to give us, an honest, open.
Yeah, that's my concern, that we'll be very honest with us when we do that.
Yeah, so I think it is balancing, whose needs are we serving. But I think we are duty bound to be honest and open as far as humanly possible.
So does that make it a two-step process where the report is given to the agency, and with their ability to respond to concerns, and then it's made public?
Yeah, because I think people are more positive if they understand context. If you only have 6 beds and there's a waiting list of 20, if the agency can say we would love to have 20 beds, but we don't have staff, or we don't have funding, or if they can give the context of why the service is not as they would like it to be, then I think people kind of go, oh, okay, well, then those are the issues that we need to look at in the future to try and correct this issue. I think avoiding the blame game, it's not about blame. I think we can make an assumption that everybody is doing their very best, with what resources they have available. Assume good intentions, but, address the issues. I think we cannot ignore an elephant in the room if there is one.
So does that two-step process sound, like give them the report, give the agency the report, and excuse me, ask for response to any issues that we see, ask for possible next steps?
I think that it's being responsible on our part to give, if there are any areas of concern, to give the agency involved an opportunity to respond before anything's made public. The second part of my response to, I agree with Kathy that I'm not particularly comfortable having a policy of just putting every single report out there on the website directly visible. I would support having a comment saying reports are available on these agencies by request, so that it's not something someone can casually scan and start attacking necessarily, if that's their intent. But if they do have a concern, they just simply request it, they get their copy, and it's available. It's not withholding anything, and it's clearly stated that it's available.
Any other comments?
Yeah, I think whatever policy we come up with, or whatever we decide to do, I think being transparent and upfront with the agencies that we are approaching also feels very important.
Bill, do you have a comment on this at all?
I think it's largely policy issues for you all to decide as the board. I think that my impression is that a mental health board appointed by the Board of Supervisors to provide oversight function should probably lean in the direction of making anything you publish available for everybody. That I'm not saying I think you have to. I'm offering my impression that that's the purpose of, consistent in my experience with the purpose of a board like this. The thing to think about is, if you're going to do that, create reports that are going to be less problematic. And by that, I think you do the things you're talking about, which is, one is you take steps to get input before you publish it, so that you're less likely to be surprised by a controversy. And then, it's inevitable that if you write a report that's going to be for public consumption, you're going to choose your language differently, right? I mean, that's just a reality about communication, so that when you write a report, keep in mind, this is going to write it as if a large audience is going to review it. And in most cases, I think you can hit a balance and be honest and prudent.
Okay. So it sounds like with Bob Cobb's input and Carol's, that if we plan to make the reports available. So a statement would be that this site visit has been done, and then at some point somewhere there would be a statement that the site visits are available upon request. And that way we're not just, putting them up on the county website, but if somebody wants one, they can ask for it. Does that sound acceptable? Okay, so Bob Cobb said that sounded good. Bob Hale?
I can live with it.
Yeah, okay. Peterson, Carol?
As long as we are 100% okay with giving whoever asks us for a report, the report. I do not believe that we should be in the business of filtering who gets access to the information. So if we agree that whoever asks for the report gets given it, even if we don't think we want to give it to them, and we're not quite sure what they're going to do with the information, I think we cannot prejudge that. So I would just have that caveat that if somebody does ask us for the information, we give it to them. That we don't say, why do you want to have this information? What are you going to do with it?
Right.
I don't think so either. I think if we already said it is available for upon request, when it is requested, we should make it available to whoever asks for it. We shouldn't decide who gets it. That's not our role. We have already said on the website it is available. Then whether it's Tom, Dick, or Harry who asks for it, Tom, Dick, or Harry should get it. And we should not filter anything or modify anything in the report. We should give it as is, if it is available for viewing.
Yeah, so that begs the question, why are we asking people to ask for it? Do we want to know who has asked for it, or who has downloaded it, or who is interested in it? Are we going to monitor that? Are we going to say, Susie Lou from Petaluma or Pengrove downloaded it on this date?
I don't know I don't know that who precisely is asking for it is of interest, but it may be a curiosity to see if one of the 6 agencies gets many requests. As then there's not much interest in the other ones. It might just prove to be interesting, but I don't see us collecting data on who's making requests.
No.
And so the question to me is, will it make any bit of difference if we have it as a publicly facing on the website available to whoever wants it versus somebody has to ask for it? Are we putting hoops for people to jump through that are not necessary if there's no purpose to it?
Being that the internet and whatever's posted on it nowadays can be proved to be a controversial issue, that someone will find some controversy in anything. This might just be a means of, if someone has interest, they make the effort to make the request. If they're just scrolling and trolling the website to look for things to pick at, then we don't need that hassle. No one does. So I don't see it as an impediment, really.
Right. Well, I think if any of you tried to find information on these websites, it's not easy, even if it's made public. So personally, I don't think that is going to be a problem. I think if somebody goes looking on the Mental Health Board website for a report on a particular agency, that is what they want. That's what they've gone there for. I think there'll be very little accidental review of these documents. Just my penny's worth.
Okay, that said, you did say a little bit earlier that as long as there was no prevention or no screening essentially of that we're responding, we're judging who gets it and who doesn't. As long as it's a totally neutral offer that it's available, you could support that? Carol?
Yes, well, basically, I'm very much for transparency and access of information. So I'm really asking, if we do ask people to go through an extra step to access that information, what is the purpose of that extra step? If there is no purpose in the extra step, then I am of the opinion that we should not put that extra level of precaution in. If
Okay,
it's public, it's public.
I have a question for Tori. On the website, Tori, how hard is it to, where would you put this information? Do you know?
I would talk with ISD and find the best place to put it unless the board has a recommendation. Yeah, I could probably post it right on the front page, or I can have a link off to the left where you could click it and it would send an email requesting, it would prompt an email saying, I would like to request this report, et cetera, et cetera.
Okay, and would that be just as easy to post the report, like this site visit was done and they click on it and there's the report? Would that be just as easy?
Yes, that would mean I would have to get it loaded to the ISD website. So it's basically, my understanding is the same as posting them to the website, because you're just going to click it and it'll be downloaded by them. So versus whether, it goes back to whether or not you want it tracked or not. We could put a email on there. Sorry, we could put a notice on there. Please email the secretary at Tori.Bartholomew to request a copy of the report, and then I will pull it up and send it to them. Or they can click a link, it'll take them right to it and they could download it.
Bob Hale, did you have a comment there?
Yeah, keep in mind, there's 5 reports, not just one. 5 agencies
Oh,
So far.
so far. So if you're clicking on, you need to click on what agency had the report, because there's 5 different ones.
so I think that it would, if Tori, you can keep the reports in a folder or some sort, that requesting a specific report from Tori is probably enough transparency, and it would give us, as Bob was saying, if a lot of people are requesting a report on one agency, it's just information that maybe we need to, look at that agency and visit it again. So, okay, so I'm going to say that we are going to be transparent and that we will make a decision on whether we post the report itself or an invitation, and that either way is transparent, unless anybody has a very strong objection to that right now, because I want to move ahead to let Bill give his report. So any strong objections to that? Okay, Bill.
So, as you can imagine, the news that is prominent here right now is the news that's been in the Press Democrat regarding the Department of Health Director candidate who was selected and was going to begin, take his position on December 1st, has withdrawn, citing his concern regarding the treatment of African-American department heads in Sonoma County. And this happens with the director of the Employment Development Department leaving, and of course, Barbie left in May. So We are very saddened that we don't have a director coming. We thought that, it's been difficult to function without a seated director. We're very sad about the reason why. Everybody is digesting that. Other than that, we're moving forward the projects I have reported earlier. Coming up in the next board meeting, we'll be addressing the Mental Health Student Services Act grant that the county applied for on behalf of the County Office of Education to create some mental health services in the schools. And that will create also a position in the department here to be a liaison to them. I'll be offering on the 16th an overview of CalAIM. So we've talked about CalAIM. It's a multi-part initiative that the State Department of Healthcare Services is undertaking to reform Medi-Cal with a strong focus, not a sole focus, but a strong focus on behavioral health. And so I'm offering an overview of that initiative for the Board of Supervisors, because we're bringing to them a number of decisions that are related, and we'll be continuing to bring decisions to them in the future that are related to CalAIM. It may be that at some point that the Mental Health Board would like a more comprehensive overview of that as well. You will also see that we are joining a Mesa project. So Mesa is the joint powers entity that county behavioral health departments have joined. It's an entity that allows us to do work together, creates a organizational structure to do that. We're joining a project that the counties are leading to develop an electronic health record that is designed by and for the behavioral health divisions. It's a big project. The reason it's feasible at all is CalAIM, because one of the things CalAIM will bring is payment reform. A lot of what we do is driven by layers of bureaucratic requirements that have built up over the decades. And at this point, in my opinion and the opinion of many others, we spend far too many resources, money, staff, energy on meeting administrative requirements that don't add much to care anymore. And so the idea is that payment reform is going to simplify. With the simplification, there are more opportunities to consider more electronic health records. Right now, the requirements that exist limit the number of electronic health records we can consider. And so we're joining that project to ideally build an electronic health record that would be available over the next year or two to county behavioral health departments and would improve our functioning. And so those are the behavioral health issues coming before the board in November. In December, we bring the PUF Crestwood agreement. So that will be moving forward then, as well as Measure O steps that I've outlined to implement the next stages of projects supported by Measure O. The Mental Health Services Act annual report and update is coming up, but you guys will get a preview of that. And then also in December, the two contracts I previewed. So these were Mental Health Services Act Oversight and Accountability Commission grants. One for mental health services, which is SCO, the County Office of Education. The other is the Early Psychosis Intervention Project that Aldea and Buckaloo will be leading. That contract also goes to the board in December. So those two projects will be poised to begin in January. And then lastly, the board is going to appoint the Measure O Citizens Oversight Committee at the December 14th.
Questions for Bill? Carol?
Just wondering how the Mesa pathway to care certification is moving along and who at the county is responsible for that.
So I know from communications I see from the Department of Healthcare Services in Mesa that they continue to work on that project. There's been no deadlines or deliverables for us to respond to that have been announced yet. I am following the Mesa work. That will be transitioned to Karen Salidi, or no, Chris Marlowe. Will be my delegate when represent us at Mesa when I leave in January.
So as far as you know, there is nothing that the counties have to deliver for the November 19th proposal. Mesa is going to deliver one for all counties. Is that correct?
I am not aware of any response. There's been no outline of no response we have to make on this yet. We expect at some point that there's going to be a request for us to opt in, as you have pointed out. We're waiting for that direction. It's not come yet.
Okay, because I think that's very confusing to me, that the proposal to DHCS is a deliverable from Mesa for the counties on November 19th, and the counties have had no input to that. That is very confusing to me.
It's, yeah, the process is designed by the Department of Healthcare Services, so they are the ones leading this process. I know that Mesa has established committees for input on the project, so I think Carol, you forwarded those as well, so I believe you've seen those. So I know that's happening, but yeah, again, no clear direction to us about what counties need to do at this point.
Have the counties of their own volition given input to the stakeholder process?
Yes, through CBHDA. And Mesa, because we all sit on the Mesa board.
Bill, will there be an interim director appointed in January, or?
For behavioral health or for the Department of Health?
Behavioral health.
So no decision's been made. I'm creating a series of options that I will offer to the department, and I hope to deliver that to them next week. So I've been looking for potential resources, individuals who have background experience who might be interested in serving as an interim director, and then other recommendations regarding what we could do internally. So I will offer recommendations to them next week. My hope is they would make a decision, by the end of the month to do something.
Now, how many years have you worked in the behavioral health setting, in the public setting?
Most of my work has been in the private nonprofit, so I've always worked in the public mental health system. So that's 40,
Wow.
almost 40 years. And then I've been a public sector employee since 2010.
Wow. That's a long time.
That's what happens. You know that, huh?
That's true.
Any other questions for Bill? Okay, I see no hands, Bill, so you are free to go and play with the
Thank you all.
budget.
Good to
Thank
see
you.
you.
Thank you, Bill.
Bye-bye.
Thank you.
Okay. So we have, we're on number 5. November 4th, tomorrow, is the MHSA annual review. And we are the hosts, so please be there. And that's the regular time, 5 to 7. And it will be, our part will just be very brief. It's going to be there, and then Melissa's going to take over. So, but it's always interesting to hear from the different programs. And then November 16th is our regular meeting, and that is South County issues. And Carol and Marianne have been working on getting people to present there. So Carol or Marianne, would you like to say anything about that?
I would just like to thank Carol for doing this. Can you guys hear me?
Yes.
Oh, good. She is much more active in the community lately than I am and knows a lot of the players, and she is taking the lead. And she did a lovely job with the peers presentation. All of you enjoyed that, I'm sure.
It was quite good.
And she coordinated that as well. So thank you, Carol.
Carol,
I don't see her box here. Oh well.
I don't either. I don't know what happened, because she was here before for sure. Well, when she comes back, we can, if she has anything to say about that, we can ask her. Bill's already given his presentation. Okay. We need to figure out if there are next steps for places to visit. Any suggestions for Bob Hales for places to visit? So we have looked at Progress Foundation pretty closely. And
Luckily,
oh, go ahead, Bob.
we've looked at Community Support Network, interviewed Tara Gallo and Rita Larson. That's the Brown Street and Hope House.
Were you able to visit those sites?
No, they did a creative way though to show video.
Uh-huh.
Bob, you were there. Do you want to comment?
You're muted, Bob.
Okay, thanks. It was a virtual visit with 2 of the key staff, and I think it was pretty comprehensive. And as we've said before, it was a very favorable impression that we came away with. Just for future, as long as I'm speaking, eventually down the road a piece, it would be useful, I think, to put the upcoming PUF on a list of site visits, but it's way too early for that. But just that would be useful, I think, maybe even in the early several months of their operation, just to get kind of a baseline of how they're starting out.
Good idea.
Do we know who is going to run that path? I'm just curious.
I think I heard who was doing it, right? I
Yeah.
think I heard it was Crestwood.
Yes, Crestwood. That's correct.
And they have quite a few facilities in other places.
Yeah, they operate one in Sacramento right across from the Med Center, so very well received. We also visited West County Community Services with a focus on senior peer counseling and senior adult counseling. And Carol West also attended that. And we interviewed Melissa Fike. And then
So-
Progress Foundation, which was Progress Sonoma. That's Lizzie Pickering and Elizabeth Hernandez. And you were with me, Kathy. on
Yes,
that.
I was.
And then Buckaloo programs, Danielle Holmes, Jamie Burke, and the director even, Chris Coogan, Kughn, and Becky Enos and I conducted that. And then we interviewed Wendy, I think it's pronounced Tepone, the mobile support team. I guess the key question, do we want to visit contracted agencies, which seems most logical, or do we want to interview, in addition, county-run agencies? MST was an example of one. In other words, do you want to check out and do site visits and contracted agencies, or just any agencies, even if it's a county operated? Like the PUF would be a contracted agency with Crestwood. And the
Right.
mobile support team is really a county operated agency, best my knowledge.
Right. So really the agencies that we visited so far are contract agencies.
Except for the MST.
Right. So, and all of them have been adult, except for West County, which was older adult.
Yes.
I think there was a time, I believe Peterson was involved, where we scheduled to visit the Say site, and that was postponed. If my recollection is correct, that might be something to put back on the list, and if Peterson's available to set that up at some future time.
That sounds good. I don't hear Peterson. He may have stepped away. So
Well,
so
there are quite a few options, going down the list. I see Mary Frances is here. There's NAMI, there's SOS Counseling, there's a lot. But I guess we've taken a tour of the CSU, but have we ever done a site visit there?
Yes, we have.
Okay.
When Dick was on, Dick.
Oh, okay. Right.
and I was there too.
Yeah.
So what are the other county-run
Well,
options?
in West County Community Services, there's a peer center, Interlink, Wellness and Advocacy, Empowerment Center, Peer Recovery Center, Sanctuary Villas. That's Community Support Network. And we did Brown Street and Hope House. There's a Step Up Bridges, but I thought we did that before, Kathy.
We had a step up in bridges.
Yes.
I don't think so.
Okay, so that would be one to visit.
Yes,
Opportunity House.
I
yes.
see Mary Frances has her hand raised.
Yeah, that would be great.
Oh, can you hear me? Yeah.
Yes.
I just wanted to say you're welcome to come see NAMI Sonoma County. I'm happy. Everything is still virtual for us. But if there is an interest in just understanding where we are and what we do, learning about it, and happy to host a visit anytime. But at this time, nothing is live here. It's all by Zoom, is what I'm trying to say.
Yeah,
To
and
observe an actual program. Yeah.
I think that's really true. I mean, even though the people like at the programs are there, with our site visits being virtual, it's really different
Yeah,
to,
Okay.
For the heads of the programs to say, this is what we do. And I mean, that's really different than standing in a place and getting a feel for it. So,
Yeah.
It may be that we want to revisit some of these places, but I don't see any Buckaloo programs on this. So maybe look into some Buckaloo programs because they're another big provider.
Well, I think they operate Manor House, McBride, and North Petaluma apartments. I thought McBride Manor House, we reviewed.
So we did McBride and Manor House, right?
That's my belief.
There are also some of the contract agencies that provide services to children or children and parents that I don't think we've touched on.
Yes, that's a lack. So Buckaloo is one of the bigger providers that we haven't visited at all. And what are the programs for children? Say would be one, but there's others. And there are some that are for young children as well. So maybe Bob, you can get a list of those and pick one or two.
Is First Five a contractor? Do we know?
I don't know.
Okay, of course, there's CPI.
Yes. And I'd be willing to do one of those visits with you, Bob.
Marianne, do you have other thoughts on agencies that particularly provide services to children or children and parents?
I do not at this point have any ideas for you. I think, no, I'll just say I don't have any suggestions.
Thanks.
Uh-huh.
It might be interesting to contact, was it SCO that's the contractor for the school services that are going to be provided? Get a description of them and visit them. So Bob, if you can put, pull together a few from that list, and I'm willing to visit one with you if there's some other people that would like to help out with some of the visits. Let Bob know, and I'll put it out. Any other things on the site visits? Okay. It says under other reports, the California, the COM board and ad hoc committees. Well, I did attend a COM board meeting, and I will comment on that in a few minutes. I think Carol's keeping us up to date on the peer centers. I'm looking at the what it says in other reports, the peer provider issues. mental health needs at the main health adult detention facility. It's all site visit stuff mostly. So do you feel
Do-
covered?
do-
Oh,
Do we have any idea, excuse me, of what the mental health services and needs at the adult detention facility are? Bob, I guess they've kind of pulled away from us. That's my impression.
Yes, Carol West has the most knowledge of that, but it just kind of went away. Interactions were pretty intense, and we had some good meetings, but then the follow-up, coming to, well, they also made a presentation to the mental health board, I believe, one time. But in terms of follow-up with regard to the new jail or anything related to it, there wasn't any activity. Just kind of disappeared.
so maybe that's something to readdress.
Mary Frances has her hand up.
I just wanted to add that today I'm attending, I was invited to join the Stepping Up Committee. I don't know if you are familiar with that, but that is that's a county level committee with many different law enforcement related agencies participating. And Stepping Up is a nationwide movement to improve the relationship between mental health and the criminal justice system, or meaning the treatment of individuals who have serious mental health conditions. And I was reading, I have not been at the meeting yet, but I was reading the minutes, and there is a report that there have been significant changes in personnel at the jail. One of which is, I think, changes in the WellPath staff. So I hope to hear that today. And Bob Hills, I'm happy to share that with you and Carol, as far as the jail mental health work group. But I think that is part of the issue of why there has been a lack of communication, because they've been interviewing, have had trouble filling positions, just like Sonoma County Behavioral Health. And I think that's had an impact on communications. In addition to which, they lost Robert Travelstead, who was the deputy who was overseeing reworking of the contract to create the new improved mental health unit within the jail. And he was lost to the COVID-19 when he got sick. Then he was overseeing that whole project. So, I think there's been a number of disruptions in terms of personnel, and that may account for part of the silence. So just wanted to share that much.
That would be appreciated if you could share
Yeah,
that.
I'd be happy to, as soon as I learn something I can share, I will. Thank you.
Okay, thank you very much.
Sure.
Madam Chair, it's Mary Ann. If I may just interrupt, and my apologies to the board. I need to leave the meeting early. Keep up the good work, all of you. This has all been so challenging and interesting. Thank you. Bye-bye.
Okay, bye,
Mary
Mary
Ann.
Ann.
Bye.
Okay, so the next item is acknowledging behavioral health staff, and Bill Carter is coming up. So I know that, obviously I can make him a certificate and talk about him and appreciate him, but should we do anything more than that? I know I'll do at least that.
We could have a virtual cake.
A virtual what?
Cake.
A cake. Oh, that's a good one. Yeah, put the little cake on the screen. Okay, well, you will all have a chance to, put your 2 cents in, and talk when we do our appreciation. So kind of be thinking about what you'd like to say.
Is this for the December
No.
meeting or when?
November, because
Oh, for November's.
we
Okay.
decided a while ago, and I don't think we've changed our minds that we were not meeting in December.
Oh, you're right. I'm so used to the shift in schedule where we're meeting in August and December. I forgot that that's
Right.
not normal.
And I've been defending that decision quite strenuously. So, people saying, well, we need to do something in December. Nope, we're not meeting. Okay. So that's for the November meeting. Okay. So just be prepared to talk. And I think that the certificate is fine. Okay, so special present. Oh, let me just jump to the data notebook because I think that Michael's wanted to speak, and it may take a few. But the data notebook is, I know that Tori's been working on it, and I know that several people have been working on it, and I'm just totally spacing her name right now. Susan Castillo has been working on it, and we have been invited. It needs mental health board input, and we don't have the data notebook in front of us to work on, but we've been invited on November 15th at 9 a.m. to work on it with Susan, and I think there's one other county person working on it. So if anybody would like to Zoom on November 15th at 9 a.m. and finish it off, I would prefer not to be the only one there. That's what it is at this point. So if somebody else would be available to do that, that would be great.
Will that that announcement be sent out to the whole mental health board?
Yes.
Okay.
So Tori, can you send that that request out?
Kathy,
Yes. And then I will also email out the data notebook with the information that I've compiled so far, along with that request, if that's helpful.
Yes, it would be.
You got it.
Kathy, are there any written materials that you've prepared in your meetings to look at?
Just the data notebook. I don't have anything beyond.
Okay.
Just what they basically, I think what it is that there were a whole bunch of questions that we couldn't answer because they were more data. But then there are questions that, are our perceptions, observations, etc. That and they're listed in the data notebook that Tori's going to send out.
Okay. And that
So-
would be the purpose of the meeting on November 15th.
To finish it off so it can be submitted.
Okay.
Okay. Michael and Vanessa we had talked about them wanting to have a presentation in February, and the Michael, do you want to just go ahead and describe what you're thinking?
Yeah, I was hoping Vanessa would have been here too, but that's okay. So we got together last week and had like a chat on what the possibilities would be of holding a like mental health based forum around like the pandemic and isolation, and like resiliency and mental health in regards to what we've all been through over the last year and a half. So we put together this document of different ideas of what we could do. I'll just kind of read through them, and we can, any input would be appreciated. So the purpose is to elevate and open up a dialogue on the last year and a half we spent through isolation and the pandemic, to come together in a forum now that we can. And it's kind of a sporadic document, but thoughts would be focus on the importance of opening up about the anxieties surrounding COVID, talk about the resiliency we've all shown. I think it's really important to talk about, to have a, and now moving forward with reflection tone in this forum. Have a Q&A section where people are allowed to talk about their experiences. People are allowed to talk to experts and board members. I like the idea of having like mental health advocates there, or like psychologists there, like people for just the public to talk to. Thoughts we've had, like, okay, there's like healthcare fairs that happen. Like, would it be possible to like get a table at a healthcare fair as like part of a mental health care division at the forum? If we can do this in person, which I think would be really good. I work at Brew, which is a coffee shop in Santa Rosa, and they have a really big patio space. And they said they'd be open to us talking there. Vanessa had talked about the importance of maybe doing 2 events, one in English and one in Spanish, because I know we've talked a lot about how the Latinx community is often left out of the dialogue surrounding mental health. So like that was a really big idea. But yeah, it's just overall, like, we've thought about reaching out to JCs and universities. We thought about like, okay, like if we do it at Brew, we could have like a general community event, and then Brew is a LGBTQ run cafe, and so maybe we could do one for the LGBTQ community. Yeah, so I think the big ideas were like we could do a Zoom public forum, and then also like an in-person public forum, just about like creating an outlet for people to talk about like the mental health and the struggles they faced over the pandemic. Those were kind of the big thoughts on that.
So Carol just did the peer certification one, and that Erica Chloe facilitated that and did a good job. And basically that was more people talking about their experience of peers working. Are you thinking of something like that, to getting a panel together to talk about their experiences, so that it was the result of Carol's was more like, you're not alone. This is, this is happening to a lot of people. Is that what you're looking at?
Yeah, I think my focus has been on the thought of like the importance of acknowledging the stress and anxiety that we've all been through, And yeah, like I don't know if like board members could just go and talk about what they've dealt with over the last year and a half. And yeah, creating a possibility for then like the public to have a place to come and talk and connect over like the issues they faced.
So are you talking about them connecting with us or connecting with each other? Because I don't know what exactly it would look like if we are, we are not therapists, except for a few of us who definitely are. But I'm wondering how that would, how the public interacting with us would look.
I mean, I think, like those of us who are therapists and social worker involved or in the world, like that is important to have. But I also think that like we don't need to be experts just to say we had a hard time, and I think just the board, like in my mind, like an ideal situation would be like, hey, we're just members of the community and we're talking about what we've been through, which creates a more casual and open dialogue, like is how I was kind of picturing it. And that was a big thing for me, is just like the more instances we can have of people talking about mental health, the like more it can be destigmatized, the more it can be open, and the more it can be more of like a relaxed and casual thing that like people just talk about. Like we don't need to be experts on the situation just to talk about what we went through, is my mind.
Right. Okay, so I'm getting that. That's talking about what we went through. The thing I'm not sure about is beyond us, as far as the public interacting with this. I'm not sure how that would look. Are you going to, are you thinking of having other panelists from other areas?
I mean, we absolutely can. There's no reason to limit it to just the board, but like, I mean, in my mind, it's just like, hey, general public, hey, person, like, do you want to come up to the microphone and like say what you've been through, or like say what the dealing with COVID has been like for you? Like, have you lost anyone? What have you experienced? Was it stressful for you? Like, it's just about like bringing the community together, which I think is really important to do after we have all spent so much time in isolation.
Okay, so I think I think it's a good idea, and I think that the general concept is good. I'm not sure that people, because we're very public, especially if we're still on Zoom, which I think we may very well be. I think that people who are just listening may not feel comfortable, stepping out into a recorded situation like we've got. So my thought is that it might be good to have, to actually contact people who are willing to say, oh, this this was really difficult, and share in that forum, so that you're not putting people on the spot and having them speak, like off the cuff and then regret having said what they said, kind of thing.
Well, I mean, in my mind, it's like, I mean, like if it was something we could do in person, I think that would be really helpful. Like do a brew or whatever. but my thought is like the people who come and like, so long as we create an environment of just like open and accepting dialogue, it's more likely that people will be willing to speak up and talk about their experiences. Like, because for me, it's like the board has the potential to kind of lead a dialogue in like this situation. Like, the pandemic, a lot is focused on like the health crisis, obviously, but not as much has been said about like the mental strain of what people have been through. And I'm not saying present ourselves as like experts on this situation, but as board members on mental health, I think it's kind of important for us to try and like and just see how it goes. And if we end up just talking to ourselves, we end up just talking to ourselves. But I think even that would be helpful.
So are you going to have like some questions, just a few questions to answer
Yeah.
so that we have a guide?
Yeah, we can definitely throw that together.
Okay. So does anybody else have input for Michael or questions or comments? Bob Cobb?
It sounds like the conversation's gone in a couple different directions. So from what I hear, maybe it would take the format of board members may choose to disclose what it has been like for them during this time, but that we would also have pre-invited people from various directions within the community who have agreed to speak their experience. And then the third group would be whomever else is attending who may spontaneously want to join in and share their experience as well.
Yeah, I think that's how I'm picturing it going. And the hope is just to like, I think I said this, but like create a more casual dialogue around mental health, so it kind of like takes it back off the mountain of like this huge like grand thing that people have to like invest and talk about. Like, whereas instead it can just be like, no, we're just like casually talking about mental health and this is totally normal. But yes, I do see it as like us talking, talk to a couple experts and then open it up to the public.
So what would it look like if it were to be being done virtually? Does that present any kind of issue that you foresee, Michael?
I mean, I don't know how it would be any different than, any time in the past when we've had like guest speakers and stuff like that. I assume, Vanessa's not here, but I assume like Vanessa and I would kind of lead the dialogue and could act as like moderators in a way, like guide the questions and stuff like that, and guide the conversation. And then, yeah, like just how we have guest speakers come to the board, like, we can have people in the same capacity. And then at the end of it, we can open it up to anyone who wants to ask questions. But I would like to try and do a live event at Brew if the board was fine with that. I don't know where we're at with live events though.
Yeah, but that's pretty hard to predict at the moment. The other thing might be what sort of turnout in February if it's outdoors.
Right.
Yeah, it might be cold or pouring.
Yeah.
Yeah, with a little luck, it might be pouring.
Yeah.
Yeah, I mean,
and a live event is a little bit more difficult to, well, one, it's difficult to project whether we're actually going to be able to do a live event. The weather is an issue. and getting people to come from a variety of places might also be, you know, an issue. So I think that I would plan at this point on how you would do a virtual event. I think that getting people to participate, even the panelists to participate at this point, would be easier, especially because our normal board meetings, if you're looking at this being a board meeting, are in the evening. And even if it is a nice day in February, that's going to be, you know, difficult.
Right.
So I think that I would go for the virtual event at this point,
Mm-hmm.
and see if you could see how many people you might want to invite, what type of people you might want to invite, and what questions you would ask.
Okay.
So, you know, and I'd be happy to take a look at the questions, and I don't know, maybe Bob could give some input. I mean, there's only 3 of us left here now, so yeah, so if you know, think about, and I'm thinking type of person. So like when Erica has done her events, she will get a group of panelists together, and she'll pick somebody who's talking about this, you know, this aspect of life, somebody who's talking about this aspect of life, you know, kind of narrow down your focus and get questions and a possible, you know, couple panelists, and let us know how that's going.
All right. Yeah, I'll try and connect with Vanessa to continue the dialogue about how this is going to look, and then circle back with an email to the board, because we're not meeting in December, right?
We're not meeting for our regular meeting in December. I don't think we're meeting as an executive board, but that may need to happen. I'm not sure. We'll see if, you know, we have to have that short meeting.
Okay.
Okay.
Sounds good.
Thanks for the input, Michael.
Yeah. Thanks for hearing it out.
Yeah, I think it's some good, it's a good idea. It just needs to be kind of, you know, fleshed out a little bit and get the questions and all of that together.
Okay. Sounds good.
Okay.
All right. I gotta head to a work meeting.
Yeah, and I think that I don't think there's anything else. I don't know if there's who's still here. There's
I have a quick one. Sorry.
Yes.
I know there's not a lot of people here, but and I sent out an email, a reminder for the oh fuzz, I just went blank on it. The training that we have to do.
The ethics training.
Goodness, Bob. Thank you, Bob. I knew you just sent me yours. So the ethics training. So but I sent out a reminder, you know, email to everyone as well.
Okay.
That was the only thing I had left.
Okay. Perfect. Then I think we're done. Thank you, Bob and Bob, for hanging in to the